Hey everyone, this is Daniela from the Obstacle Doc, and today we're talking about the hip hinge. The hip hinge is a foundational movement to a deadlift to a kettlebell swing. It's actually a part of the squat component as well to initiate movement. This is something that we get a lot of questions about when it comes to low back pain, hip weakness. So we love to focus in on this, and we'll break it down fully today. So when we're talking about a hip hinge, we like to appreciate what neutral spine looks like. So from top to tail, we're looking at the line on the back side here of this middle skeleton being the back of the head, the middle of the thoracic spine, or just between the shoulder blades there, and then the tailbone. So we're going to ignore the gluteal fold here, and this would be the long line. So when we talk about our hinge, we're actually focusing that the axis of movement is here on the ball and socket of the hip joint, and that it's not coming from the middle of the lumbar spine. Okay, so it's a little bit of a lower bisection here when you actually cross into, I'm not going to hit your head, into our deadlift or into our squat or into our kettlebell swing, right? So this motion's coming from just below the hip bone or the crest of the hip that you feel on your side. So if we're going to start looking at this in standing, Christopher's going to take this stick. This is something that could be either a PVC pipe, a Swiffer, a broom, whatever you have in your house to give you 3 points of contact. So we're looking at the tail, not the tailbone, but just above the sacrum or on the sacrum between the butt cheeks. We're looking at between the shoulder blades, so just that thoracic spine right there, and then the top of the head. You are going to have 2 natural spaces in this line. So we're going to have a space behind the cervical spine, and we are going to have a space in the lumbar spine. There is a natural curve, and we want to keep it. We just don't want to exaggerate it or make it completely go away. So he is holding the stick just with his hand turned towards the back, and that's keeping a little bit of that natural space here. What you're going to feel in the start, and if you are interested in how we set this up, you can go to our ideal posture video, is we are trying to keep some tension through the front and through the back side of the body. So to keep himself on this line, if you're very posturally tight in the forward direction, because most of us work forward on computers, on phones, that kind of thing, he has to work to pull back a little bit from the shoulders. He's got to pull his head back in that line. We're keeping his rib cage closed, so he is not able to flare and open from the front. That would exaggerate that curve in the lumbar spine. And then he's also squeezing from the glutes already to hold himself in neutral. So just holding this neutral position to start the hinge is some work. That's okay. The easier that this gets, the more fluid you can start with your hinge. So keeping himself on this line, we're going to imagine that there's another line here in your hips, and you are pushing the butt back towards the imaginary chair behind you. So the knees do bend, but the knees are bending because the femur at the proximal end, so at the hip, is pushing back, and that's what's bending the knees. So give me a bad rep where you're bending from your knees. Yep. So you can see he's still staying a little bit more upright versus if he's driving through a true hinge, he is going to let his shoulders come forward and his glutes are going to go back. Perfect. So as far as how low you want to go, we are looking to try to get to the bony part below our kneecap. So there's a little tibial bone, your tibia right here. So there's a little bumpy part right underneath. Most people are just like, my shin bone. We're trying to aim to the shin bone. So if you can reach that part, I can hold this so you can put your hands down just below the kneecap. So that's perfect. So you can come back up. And then we want to try to rep this out. So the more ensconced this is in your system, the easier it's going to be to add load to it. So as far as length, so we're trying to get our hands to go just beneath our kneecaps. So just going to that little shin protrusion that you feel below. If we are breaking off of this point, there's really 3 main ways that we see this happen. So if you want to move your hand. So if Christopher loses the line, most common thing that we see is losing the line from the lumbar spine. So the belly starts to drop, this starts to get more exaggerated, and there's more space from the line to the lumbar spine. The other ways that we can start to lose this, if you get back on, is if we have weights in our hands, if that's a dumbbell, if that's a kettlebell, if that's a barbell. If he starts letting his shoulders cave forward, now we have not only lost this point, but we've also lost the head. So this is where we can start to get some neck and shoulder pain, this is still going to have to try to compensate for the lack of stability through the rest of the spine. The last way is and we see this often, if you start looking out in front of you, so now this has an excess curve, and a lot of the times when we start looking up and breaking through the cervical spine, we start to get an increased space here as well. So everything just kind of scoops off the line. So we're trying to keep head, shoulders, neck, low back all in one lovely line. This does get affected as you increase load and as you increase speed. So if we're going heavier, if we're going faster, this can start to break down. So that's why we really want to rep this out and make it clean. So the first way we like to teach this is by getting an understanding of the abdominals and of the glutes in a supine position. So we have a bridge video that you can go to kind of learn the foundational position of that. We're going to come up to our kneeling position right now, just to kind of move things along. So we can practice our hip hinge in our kneeling position. And the nice thing about this is that it's actually cutting into what your hip flexors are doing as well. So if you have really tight hip flexors, sometimes your bridge is not going to be super clean. It's not going to be super high. That's okay. But this is really going to show some of that tension. So if Christopher works on, here, I'm going to give you the pull. If we're still working on that nice long line. So if we have a really heavy leg day, if we're doing a lot of running, a lot of cycling, anything that's really pushing quad, pushing hip flexor, this can start to get really locked up and really hard to maintain. So that's something else we try to appraise is there difficulty in finding neutral and getting to the start of the hinge because of any tension here. And we can talk about that in another video. We have our hip flexor stretch and conversation that we can go over. So Christopher's going to try to hold this line. And from this position, we are going to try to get the glutes to go back to the heels. Important to remember, we are letting the chest come forward with control, not rounding off of the back, not rounding through the neck. And then we're going to squeeze even more to come back up. So he is practicing the hinge, lower load, because he's actually cutting down some of that range of motion. With gravity, he's not having to balance through, but we can get really clean through the hips. And we can actually load this as well. So if standing and doing a deadlift is really difficult because we have to go so far down to the ground, we can actually load you up in this position as well. So the last way that we can challenge the hip hinge is in a more functional position with a resistant band. So we are going to wrap it either in a door jam, this is on a rig, whatever you have accessible for you. And the band is going to go just across the hip point. So if you feel for your bony bumps, you're going to have the band go right across there. Remember, the line of the axis of rotation is here. It's not here. So just below that hip crest. And what we're going to do is you're going to see he's almost leaning forward. So there's enough tension against the band that he has to stay active in his neutral spine and standing. But he is having a little bit of that forward lean because he's trusting the band to hold him. So then once we find that lean, we are going to, with control, let our hips come back into our hinge as we bend forward. So really important, we're not, again, keeping the knees straight, because if we keep the knees straight, we don't have as much control. We're just going to kind of fall forward. We are letting the knees bend and come back because the hips are coming back. So Christopher's trying to work through this range, not trying to lose from here. Yep, very good. Awesome. So again, with this, we're trying to rep out and get increased control with the descent. So he's eccentrically working as he's lowering down, not letting the band win completely, just guiding his hips backwards into that hinge motion. We can give you dumbbell, we can give you barbell, we can give you kettlebell swing. All of those can be translated into this position so that you can keep practicing that foundational movement.